Hello and welcome to the MediByte channel. As a healthcare professional, I know firsthand that early pregnancy is an absolutely incredibly exciting time. But let's be real, it can also bring about a whole lot of anxiety, especially when your body starts doing things you completely weren't expected. So let's dive right into this explainer on a very common and understandably stressful concern: pelvic pain and vaginal bleeding during early pregnancy. Our goal today is to give you a complete, detailed, and super easy to understand breakdown of exactly what's happening in your body straight from the medical experts. Here's our quick roadmap for today. We're going to cover 1. Normal changes, 2. Warning signs, 3. Ectopic pregnancies, 4. Vaginal bleeding, 5. Medical evaluation, and 6. Treatments. You know, this is the absolute fundamental question every expectant parent asks when they feel an unexpected twinge. When you feel a sudden cramp, it's so easy for your mind to just race right to the worst-case scenario. So let's start by normalizing those concerns. Your body is undergoing a massive, literal transformation right now. We're going to empower you with the knowledge to tell the difference between the completely normal growing pains of pregnancy and the moments when you actually need to call your doctor. Okay, Section 1, Normal Changes During Pregnancy. While a great, quick tool for self-assessment is remembering that location is key, pelvic pain hits right in the lowest part of your abdomen, down in the pelvis. And honestly, early in pregnancy, this type of pain is incredibly common. It's often just the normal shifting and stretching of your bones and ligaments as they work hard to accommodate the growing fetus. It might feel sharp or kind of like mild menstrual cramps, and it may just come and go. On the flip side, pain higher up, in the middle or upper area near your stomach and intestines, is considered abdominal pain. That might require a closer look to rule out everyday digestive issues. Moving on to Section 2, Recognizing the Warning Signs. All right, so here is the absolutely crucial point. If you experience any of these specific warning signs, you need medical attention right away. If you have vaginal bleeding, fever and chills, especially if they're paired with painful urination or back pain, or severe pain that actually gets worse when you move around, you've got to call your doctor. But pay special attention to those last two: fainting, lightheadedness, or a rapid heart rate. These are red flags suggesting your blood pressure might be dropping dangerously low, which can possibly lead to shock. If you experience these, you literally must see a doctor immediately. Next up, Section 3, Ectopic Pregnancies and Emergencies. An ectopic pregnancy is the most serious cause of pelvic pain during early pregnancy, and it is a true life-threatening emergency. Basically, this occurs when a pregnancy implants outside the uterus, most commonly in a fallopian tube, but it can actually happen in the ovary, cervix, or even the abdomen. Because a pregnancy simply cannot develop normally in these tight little spaces, as it grows, it can cause the tissue or the tube to burst, and that leads to sudden, severe pain and heavy internal bleeding. When diagnosed, this always requires emergency medical intervention, either through medications or surgery to protect the pregnant woman's life. So understanding your personal risk is pretty crucial here. Having had a previous ectopic pregnancy is actually the single most important risk factor. Other things to watch out for include previous abdominal surgeries, especially a tubal ligation, fallopian tube abnormalities, getting pregnant while an IUD is in place, or using in vitro fertilization. Even a history of pelvic infections or smoking can elevate this risk. Really, knowing your medical history is your absolute best defense. Another very difficult but super important topic we need to cover is miscarriage, which is actually the most common pregnancy-related cause of early pelvic pain and bleeding. A miscarriage usually happens in stages. It often kicks off with vaginal bleeding, which then develops into cramping that can become quite severe and typically ends with the passing of pregnancy tissue. Sometimes, though, a miscarriage doesn't cause any immediate symptoms at all and is only discovered during a routine ultrasound. Now, understanding the specific risk factors for miscarriage can really help you and your doctor better evaluate your unique situation. Risks do increase if you're over the age of 35, if you have a history of previous miscarriages, or if there are structural abnormalities in the uterus, like fibroids or scarring. Lifestyle factors play a big part too. Cigarette smoking and the use of alcohol or illicit drugs like cocaine significantly increase the risk. Let's switch gears to Section 4. Navigating vaginal bleeding. 20 to 30%. Get this, that actually represents the percentage of women who experience vaginal bleeding during the first 20 weeks of pregnancy. I'm highlighting this to show you that it is incredibly common. While bleeding can totally be a sign of a miscarriage or severe problem, many women with light bleeding or spotting in early pregnancy go on to have completely healthy full-term deliveries. The amount of bleeding definitely matters. Passing large amounts of blood or clots is always a major concern, but even mild spotting should be reported to your doctor just so they can ensure everything is okay.
All right, Section 5, how doctors evaluate symptoms.
If you're experiencing any of these symptoms, heading to the doctor can feel pretty terrifying. So let's demystify the whole process, because knowing exactly what's going to happen can really help calm your nerves. This step-by-step diagnostic journey shows how doctors systematically rule out emergencies. They're going to start directly with your vital signs, checking for fever or dangerously low blood pressure. Next, they'll ask you some very detailed questions about the bleeding, like how many pads you're using, whether you're in pain, and your obstetric history. Then comes a physical and pelvic exam to check for tenderness or see if the cervix is opening. Finally, they rely heavily on ultrasonography to physically locate the pregnancy, along with blood tests to check your hormone levels and blood counts. Doctors basically use a specific mental framework to match your exact type of pain and bleeding to the precise tests required. For instance, if it's just normal changes, you might just feel a crampy sensation or a sharp pull when moving. In that case, a regular prenatal checkup with an ultrasound is totally sufficient. If a miscarriage is suspected due to crampy pain and bleeding, they'll closely monitor the fetal heart rate and measure your HCG hormone levels. And if an ectopic pregnancy is suspected because of sudden severe pain, well, they might need to move quickly to specialized ultrasounds or even a minor surgical procedure called laparoscopy to look directly inside your abdomen. During all this evaluation, here's a really fascinating and crucial detail: blood testing for your Rh status. If a pregnant woman with Rh-negative blood experiences any vaginal bleeding at all, she must be given a special injection called Rho-D immune globulin. Why? Because if the fetus's blood mixes with hers, her immune system might actually start producing antibodies that could attack the red blood cells of a fetus in her future pregnancies. This simple little test and treatment safely prevent that from ever happening.
And finally, Section 6, treatments and moving forward.
Your doctor is going to completely tailor the treatment to the exact cause. For an ectopic pregnancy, treatment involves specific medications to stop the pregnancy's growth or surgery to remove it. For a miscarriage, treatments can range from pain relievers and medications that help the pregnancy pass all the way to a minor surgical procedure known as a DNC to safely remove the tissue. And if it's determined you're just experiencing normal pregnancy pain, acetaminophen is generally considered the safest pain reliever. Though, for sure, always check with your physician first. The golden rule here remains: when in doubt, call your doctor. But hey, what if your doctor confirms that your pain is just the normal shifting and stretching of a totally healthy pregnancy? You definitely don't have to just suffer through it. Simple, everyday adjustments can provide immense relief. Try adopting a pregnancy-safe fitness routine, absolutely avoid heavy lifting, and maintain good posture. A really great trick is to sleep with a pillow right between your knees to align your hips. Wear supportive clothing, and honestly, most importantly, listen to your body and rest when you need it. Remember, usually pelvic pain that isn't severe or persistent is just not a cause for concern. But I want to leave you with this question: how will proactively understanding your body's signals today shape your confidence for the rest of your parenting journey? Knowledge truly is power, guys, especially when it comes to your health and the health of your growing family. Knowing what is normal and knowing exactly when to act is the first great step. If you found this explainer helpful, please remember to hit that like button, share this with anyone who might need it, and subscribe to the MediByte channel for more empowering health knowledge. Thank you so much for learning with us today, and take care of yourselves.